and solutions that guarantee and protect your health and well-being. Trust me, Ultimate Health is your best bet. Ultimate Health is a unique platform packaged to connect you directly to key health experts and practitioners. Tune in and join the family every Sunday at 2:05 p.m. on Joy 99.7 FM as we break down today's health issues in a smooth, easy to digest, interactive format designed to equip you with the skills and knowledge to meet today's health challenges. Ultimate Health is live on Facebook and YouTube. Don't miss it.
Joy 99.7 FM. Joy 99.7 FM.
Today we're talking about hepatitis. I can't help but be struck by the passing of the icon Daddy Lumba. Yesterday's vigil, candlelight vigil at the Independence Square was something else. I'll pull back something from 2003. He dropped this with Ernestine Ajiman, also known as Atiatina. Let's share some bubra.
Joy 99.7 FM. Joy 99.7 FM.
several things that can go wrong with the liver.
Okay.
So we have from maybe a toxin,
Okay.
in the liver that is being taken care of can lead to inflammation or hepatitis.
Okay.
And one of the most common toxins of the liver is alcohol.
Alcohol.
Our everyday alcohol, yes. In the western part of the world, alcohol is the leading cause of hepatitis.
Right.
Yes, both
Okay.
acute and chronic.
Okay.
But in our setting, we have the infections as the leading cause.
Infections as the leading cause.
Yes, viral hepatitis.
Viral hepatitis. So,
Exactly.
So we take alcohol. It's legal to sell and to drink, right? But you're saying in other parts of the world, this significantly compromises, damages, injures the liver,
Exactly.
and is a leading cause of hepatitis.
Exactly.
When you come to our parts of the world, you're talking about infections,
Yeah.
viruses.
Yeah.
All right. Okay. So these are the leading causes of hepatitis in our part.
In our part, sub-Saharan Africa.
Right.
Yes.
Okay. So you can get hepatitis through various paths,
Yes.
and therefore, are there different types of hepatitis?
Yes, there are different types of hepatitis. So what I spoke about, the alcohol and the other toxins, is called toxic or metabolic causes of hepatitis.
Okay.
So if you consume, it's okay to consume a moderate amount of alcohol, but when you consume above some a certain limit, for instance, it used to be 21 units for women
Okay.
and 14 units for males. Right?
Okay.
But now it's 14 units across board because
Across board.
yes, research has shown that above 14 units a week of alcohol is toxic to the
Okay.
liver.
All
And
right.
it can cause both acute or chronic.
Okay.
Acute means the liver injury is occurring 6 months or less, and chronic means that is way above 6 months,
Okay.
persisting above 6 months.
Okay.
Yes.
Right. Folks, 14 minutes past the hour, 14:14. The dial is 99.7 FM, Joy FM. The program on a Sunday afternoon most definitely is Ultimate Health, your ultimate guide to healthy living. And I'm in the lovely company of Dr. Fatima Mohammed. She's a gastroenterologist in training, a fellow in training. She's almost fully booked, or cooked, sorry, right? And she's taking us through a good understanding of hepatitis, the inflammation or injury to your liver, a very important organ in the body. So stay tuned. WhatsApp is 055 11 11 997. Share with us your concerns, your experiences, testimonies, questions about hepatitis. Okay, we'll talk a bit about prevalence because I noticed there were some differential numbers. I got to understand from reading that if you go up north, it's pretty highly prevalent, right? And Doc will be sharing with us what that means, right?
Okay.
Doc, so yeah, we've got different types.
Yes.
And therefore,
So, just moving away from the toxic. So I want to just speak a bit about the toxic before we move into the infectious causes.
Okay.
Yes. So say if you are taking one sachet of pure alcohol, the spirits,
okay,
a day, or 2 sachets a day for a week. That's
then I
14
shouldn't have
units.
played Bubra. Right.
Yes,
Okay.
that's 14 units. Yes, so you can easily go above the recommended weekly allowance.
Okay.
Yes, and that can lead to chronic hepatitis.
Okay, let me just help and seek your help as well to clarify. I teach substances and stuff as well. But most people, when they hear units, they are thinking glasses, bottles, cups. There is a standard unit of alcohol.
Exactly.
Right? And that's what she's talking about. Okay? So your regular bottle of beer is more than a unit.
Yeah.
Okay, so
Yes.
don't think we're talking in terms of bottles. And
Exactly.
the stronger the alcohol, the smaller the unit.
Exactly.
All right, is that right, Doc?
The stronger the alcohol, the higher the unit actually.
Okay.
So if you
No,
have
in terms of the quantity.
yes,
sorry.
the
Yeah,
quantity.
yeah,
Yes, you need smaller quantities to make that unit.
Right.
So say if you are taking like one tot of
Whiskey.
spirit,
Spirit.
whiskey.
Yeah.
You are consuming a higher amount than
Exactly.
someone who is just taking beer, for instance.
Exactly.
Yes.
Right. Okay. Right. So we've understood that those are the toxic causes.
toxic
Right.
causes.
So you're taking some. Can medicines also,
Yes. Yes. So we have drug-induced, inflammation of the liver.
Inflammation of the
Yes.
liver.
So you can have common drugs like paracetamol that we take on a daily
Right.
can also cause
If you
inflammation.
abuse them.
Yes, if you abuse it.
Right.
So for paracetamol, we say it does that in a dose-dependent fashion.
Okay.
Meaning that the higher the dose you go, the worse the inflammation that occurs. But there are other drugs that are not dependent on the dose. It could just be your regular dose prescribed by your doctor,
Right.
and then it causes liver injury. For instance, our very own coamoxiclav that we purchase every day for our chest infections and all that.
Amoxiclav is
Yeah.
an antibacterial.
It's an antibiotic. Yes.
Yeah.
But it can also cause drug-induced liver injury.
Okay.
Yes, there are some food substances as well. So herbal supplements. As a rule of thumb, we recommend that people with risk factors for liver inflammation stay away from herbal supplements and remedies, because most of these have not been studied
Right.
with
We need to
regards
know
to
what
its
the
effects
constituents and
exactly
effects are.
on the
Right.
liver. So it's safe to just stay away from it. We also have green tea. You'll be surprised to hear that green tea extracts can cause liver injury in some groups of people.
Whoa.
Yes. So it's not, I mean, we've all heard of the benefits of green tea. It's
Right,
good,
it's
but
good.
it also has that potential to cause liver injury as
Okay,
well.
great stuff. So those are toxic causes, right?
Yeah.
You're taking in something that is toxic to your system and damages your liver
Exactly.
and can lead to this inflammation that
Exactly.
we're talking about.
Exactly.
Okay, right. What about the other causes?
So we have less common autoimmune
Autoimmune,
hepatitis.
right,
So
right.
when we say autoimmune hepatitis, we mean the antibodies or the soldiers that usually protect your body from infections or germs now do not recognize your own cells again, and then they begin to attack your cells. So when they attack the liver, it's called autoimmune hepatitis. And that can also lead to acute or chronic inflammation of the liver. Yeah.
Right. So that's your body attacking itself.
Exactly.
Okay. And then the others are those the viral?
Yes, so the infectious ones are the ones that are common in sub-Saharan Africa. So we have bacterial causes, and these ones usually cause acute hepatitis, which resolve when you get treatment.
Right.
But then the viral ones are the ones that are of public health concern, and that means that they are the ones that can be transmitted from one infected person to another.
Okay.
Yes, and we've seen a rise. The trend has been it has been a rising trend, of infections of both hepatitis B and C. So for viral hepatitis, we have hepatitis A through to E. So we have A, B, C, D, and E.
All of those are viral?
Yes.
Okay.
Viral
Caused by
causes.
a virus?
Yes.
All right.
Causes of inflammation of the liver.
Okay.
But for hepatitis A and E, I'll take those two together because they have a similar mode of transmission, and how we manage it is practically the same.
Okay.
So for hepatitis A and E, they are transmitted through infected food and water.
Okay.
Yes, so when we have very poor socioeconomic status with poor handling of food, when we don't observe good hand washing practices, you may inadvertently consume food that is contaminated with hepatitis A or E virus.
Right. Very often we hear, Doc, that is contamination essentially with fecal matter.
With fecal matter. So technically, if you have a hepatitis A or E infection, sorry to say you've consumed somebody else's fecal matter.
Right.
Yes.
And that relates to poverty, insanitary conditions.
Insanitary conditions.
Right.
Yeah.
Hepatitis
A and E.
And E.
Yes.
Right. Okay.
So you may feel some fever, you may get, a feeling of unwellness, fatigue. Sometimes you may have nausea or vomiting.
Okay.
And in some very small instances, you may see yellowing of your eyes, the white of your eyes.
Okay.
Or your skin, called jaundice.
Right.
Yes.
Is your urine affected?
Yes, the urine may also become very dark in color. Yes.
All right.
Dark
Just
brown.
run through those symptoms again. Hepatitis A and
E. Yes.
Right.
Yes.
It's still viral.
It's still viral.
Transmission is through contaminated food and water. Right.
Yeah.
Right. And then the signs and symptoms of that.
So the signs and symptoms, you may have some fever, general unwellness, feeling weak, nausea, vomiting, You may also have yellowing of your eyes and skin. So it pretty much looks like our everyday infections, like malaria or the flu.
Right.
So until you go to the hospital and get tested, you may think that you just have the flu or some malaria.
Okay, great stuff. 21 minutes past the hour 2 on Joy 99.7 FM. My name is Nortey by nature. I'm in the studio with Dr. Fatima Mohammed. She's a fellow in training, a trainee gastroenterologist. Yeah, anything to do with your digestive system, she's in there, right? And we're talking about hepatitis, a very serious and unfortunately very highly prevalent or common condition, inflammation of the liver. We're talking about the different paths or causes that can lead to this inflammation. We'll talk a bit about the types of symptoms that you may see. If you have any questions, concerns, experiences, testimony, confessions, WhatsApp is 055 11 11 997. Shortly, I will activate the phone line so you can talk to the specialist in the making yourself. Okay? Are you already a physician specialist?
Yes, I am.
You're already specialized already
in general medicine,
right?
Yeah.
And then you're going further into the
into the gastrointestinal system.
Okie.
Yes. So
right.
For the A and E, they cause acute infections.
Okay.
Yes. So it would usually resolve maximum within a 2-month period. Even if you don't intervene,
it will sort itself out.
It will sort itself out.
When you say resolve, doc, does it mean it's gone?
It's gone.
Gone.
Yes, gone. But in a very small percentage of people, they may get what we call fulminant hepatitis, where the inflammation is so severe that it disrupts the normal functions of the liver.
Okay.
And it may lead to coma or even death, unfortunately.
Right.
Yes.
So we shouldn't think from your explanation that A and A are not serious.
Are innocent. Yes.
Right.
Yes.
It's a serious matter.
Yes, it
hepatitis A
and E. Yes.
Okay, right.
And once you get the infection and your body is able to take care of it, you are likely to get lifelong immunity.
Okay.
Yes, from that.
Right.
Fortunately, hepatitis A is a vaccine preventable disease.
We have a vaccine for that.
For hepatitis A.
Okay.
So you can take one shot, the first shot, and take the next one 6 months later.
Right.
But hepatitis E has no vaccine yet.
Okay.
Yes.
Right. So there's a vaccine for hepatitis A
and E.
Right.
No, A, but not E.
A and not E.
Yeah.
If I have been exposed to the A virus, am I still a good candidate for vaccination?
So you may already have natural immunity.
Okay.
Yes, that will protect you from further infections.
Okay.
But you still need to observe the universal precautions: hand washing, eat well, properly cooked food, drink clean water.
Right.
Yes.
If I have either A or E, doc, am I able to transmit this to other persons?
Yes. So because it's transmitted from the fecal matter to the food or water, household contacts are at risk. So if you're in the same house with someone who has these acute infections, you may also get it easily. Yes.
Right. So whilst I'm aware that I have this, should I be taking any precautions if I have A or E? Yes. Should I avoid? Should I be in some form of distancing, quarantine, sharing stuff?
Not necessarily isolation, but you have to also observe the universal precautions I spoke about: proper hand washing, and proper disposal of fecal matter. Don't touch food and water if you just use the toilet and all that.
Right.
Yes,
we hear a lot about those who sell cooked food and caterers and all that being tested and being required to show their hepatitis status, right? If you're selling wache, whatever, right? Why is that, and is it related to the A and E we're talking about?
Yes, so mostly related to hepatitis A,
right?
Because that's the one that can be transmitted easily through food.
Okay.
Yes.
Right.
However, like moving away from these, we have the B, C, and D,
right? And
they also move together.
Okay.
Having a similar mode of transmission.
Right.
So for hepatitis B, we have about over 250 million people living with the infection or exposed to it globally.
250 million people.
Yes, and we have 1.2 million new cases of hepatitis B infection.
Right.
Every year.
It's that serious.
That's serious.
What's the picture like when we come to Ghana?
So when we come to Ghana, we say the prevalence is about 9% averagely of the population. But as you rightly mentioned, when you go up north, upper east, upper west, and northern regions, it can go as high as 19%. That's about 2 in 10 people, approximately.
That's serious. But Doc, we'll get to symptoms of B, right? But these are high numbers, right? Indeed, I was reading something that I think was to do with hepatitis B, that it is hyper prevalent in our country.
Exactly. Hyper-endemic. Yes.
Endemic, that's the word I was looking for. Hyper-endemic. Explain that so that my listeners take it seriously.
So when we say a disease is endemic, it means it's with you all the time. There's no point in time where it ever goes away. So we say malaria is endemic. In Ghana. In Ghana. Yes. So for hepatitis B, we have the average prevalence in sub-Saharan Africa, okay, which is ranging. Some countries have about 5%, some have 7.5%, but in Ghana, I said it's as high as 19% in some areas,
locations, yes. And many of the highly prevalent areas tend to be rural.
Yes. So some factors have been shown to be associated with the high, endemicity of the hepatitis B virus, and that's because of low socioeconomic conditions. Okay. So, poverty and low socioeconomic conditions associated with high-risk behaviors. I'll come to talk about the mode of transmission so that we understand. So, unprotected sexual intercourse, blood and blood products, if you are exposed to that. Okay. And then sharing of needles, sharp objects like razors and blades. And then also mother-to-child transmission. This has been one of the
vertical transmission.
most important means by which hepatitis B.
A child can get hepatitis B from its mother.
From its mother.
In utero.
Yes. Right. And because those zones, those areas, we have very poor access to healthcare, poor access to information, testing, and treatment, they have very high endemicity, and the transmission rate is high.
Wow. Yes. 28 minutes past the hour of 2. On Joy 99.7 FM, the program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, we take on all the serious life-impacting issues, not just diseases and disorders, and we do bring in the top-notch, practitioners, professionals, well-baked, qualified, to break it down and get to inform and ultimately transform you. Today, we are in the presence of, or in the company of Dr. Fatima Mohammed. She's a gastroenterologist in training, a fellow in training. I guess fellow applies to both male and female. Fellow in training. And we're going through the basics, breaking it down. How do you get it? What is affected? What are the signs and symptoms, right? What are the different types? And then we'll move on to treatment, management, and indeed prevention. Where there are vaccines or cures, we'll make that clear to you. My WhatsApp is 055 11 11 997. I've seen some of you already busy there. Dede, I've seen you, right? Dede said we don't have sound on YouTube. Dede, let me know if that has been rectified by Ziggy. Okay, let me read a couple of these and come back to you, Doc. Sure. So, my school is busy. Okay, please, do chemicals that are applied on our farms to control weeds have any effect on our liver? Good afternoon, this is Amponsa, Bechele residential area near Michelle Camp. So hang on to that, Doc. Chemicals, pesticides, do they affect our liver? Maybe, would they be implicated perhaps in hepatitis? This one says Ultimate Health, number 1. Okay, I guess it's a series of questions. If the typical causes of hepatitis, for example, is alcohol, how then contagious is it when I don't consume alcohol, right? We talked about toxic causes or toxins that are causing it, okay? And the person says, well, I don't take alcohol, so am I clear, right? Doc will answer that in a second. Number 2, she asks, or he asks, Kwesi Nkasua, I have the yellowish color of the eyes. Oops, Ziggy, you've taken my screen away. Thank you. I have the yellow... color of my eyes when the weather is cold. What is it, right? He's relating it to the weather. the yellowing of the eyes. Okay, so let's take that first. Alcohol. I don't take alcohol. Am I safe from at least alcohol-induced
Yes.
hepatitis?
So technically, you are only safe from alcohol-induced hepatitis,
Right.
but you are still at risk of the other forms.
Right.
And as I said, the alcohol-induced is more prevalent in the Western countries. In our setting, is the infectious ones, the
Right.
viral hepatitis, that is the problem,
Okay.
the major problem.
Right.
Yes. So you still need to
check.
go get tested.
It's
yes.
still out there.
It's still out
and
there.
we're still hyper endemic. All
Yes.
right. Yellowish eyes in response or correlation to weather.
Yes, so it might not have to do anything to do with hepatitis. So, for instance, maybe if you have a sickle cell trait or a sickle cell disease itself, you know, most black people are, you know, at risk of sickle cell, and most people don't know their sickling status.
Right.
So sometimes when the weather is cold and you are exposed to the cold weather, it can trigger some
Okay.
breakdown of your blood vessels
Right.
called hemolysis, and
Hemolysis,
that
that's
can
right.
lead to the jaundice.
Okay.
It could be, but
It
you
could
still
be.
need to
You need to check
see
out.
your doctor. Yes,
Right.
to-
Bear in
to-
mind
to
that
check
Doc
you.
and I haven't broken down the diagnostic
Yeah.
processes, right? The kind of test you need to do to isolate and identify
And
if you have it and what type you do have,
Yes.
and whether it's chronic or acute.
Or acute.
We haven't done that yet.
No.
Okay. Right. Dede in Maryland. How are you, my sister? Can one get it through sharing of the toothbrush? Why are you sharing toothbrushes in Maryland? Come on. But I know the question, right? Sharing something like a toothbrush.
Yes, so there are a lot of myths, you know, surrounding hepatitis B and C.
Right.
So some people even think eating food with someone who is infected.
Kissing.
Yes, so generally, even though some variants have been found in saliva and sweat, you know, it has not been established.
Don't break my heart.
No, it hasn't been established that,
Okay.
you know, sharing food or sitting in close proximity with someone
Right.
can transmit
Sweat.
the virus. No,
No.
it hasn't been proven.
Kissing, no.
No.
Right.
Unless, just like for HIV infection, unless you have a cut on the
Cut,
lip. Yes.
laceration,
And
anything like
yes,
that.
that one, your blood is exposed to the fluid of the other person.
Okay.
Otherwise, on an intact,
Right.
you know, mucous membrane or surface, that's
normal kissing.
fine. Would not.
My
transmit
producer
it.
Ziggy asked me to ask this question, so he wants to be clear.
He wants to know.
All
Yes.
right. Okay, Ziggy, you are good to go. All right.
So generally, we don't recommend sharing toothbrushes.
Okay.
Because during brushing, you may have some micro aberrations, you know, some small cuts here and there that
Right.
you are not aware of. So I mean, generally, we don't advise that because it may present a small risk
Okay.
of transmission. Yes.
All right. And last I checked, toothbrushes are not that expensive, right? And my dentist would not be happy with me if we, didn't touch that. Hi, Nortey. I am Nyamiche, listening from Sweden. We are very educating and informative. Nortey, please, are you a doctor yourself? No, I'm just too known. Beautiful, the way you pronounce the medical terms. Very impressive. Thank you for the good work. Oh, all the way from Sweden. Nyamiche. Bless you for tuning in. We'll catch you on the regular day, Sundays at 2:05. Okay, there was another one. In terms of concentrations precisely, I knew Selassie from Jolu, the green tea, right? Just so that listeners don't get a bad impression about green tea that they would normally take. In terms, is it concentration? Is it?
Yes, so green tea extract. So, I mean, generally it's safe, but we are just putting it out there because there's that risk.
Okay.
Because people think that is a harmless substance that everybody can
So
take.
when you say extract, what exactly are you specifying for us, Doc?
So the green tea itself, and some other supplements have green tea extracts in them.
Okay.
Yes, so that can lead to a toxic cause of inflammation of the
Right.
liver.
Okay.
And there are some people who are particularly at risk, so they have a genetic alteration, and you wouldn't know if you are the one.
Okay.
So I mean, you can consume it in moderation, but just be on the lookout. If you begin to have, fatigue, yellowing of your eyes, And then you know that could be the culprit.
Okay, great stuff. 36 minutes past the hour of 2 on Joy 99.7 FM. My name is Nortey by nature. I'm in the studio with a gastroenterologist in training, Dr. Fatima Mohammed. We're breaking down hepatitis, inflammation of the liver, what causes it, what are the differential telltale signs and symptoms, how do we diagnose or test for it, and then of course we'll get into treatment and prevention. Yes, there is prevention, and in some cases she's mentioned already, your system will clear this and you may have built a natural immunity. If you have any questions, concerns, I'm going to activate my phone lines now. 030-221-6541, 030-221-6541. WhatsApp is 055-11-11-997. Ultimate Health on Joy 99.7 FM. I'm glad we've done with toothbrushes, kissing, sweat, and all that. Okay, these should I say explanations and responses you gave to my questions, do they apply across all the types of hepatitis? If you say you can't get it from kissing typically, does it, is it universal, or are there types of hepatitis that may be?
Yes, so it cuts across the B, C, and D, because they have the same mode of transmission.
Okay.
Yes. So for example, for hepatitis D in particular, we rarely hear of it because it's an infection that occurs in those who already have hepatitis B. It can only occur in those who already have hepatitis B.
So you need a foundation.
You need a foundation of an existing hepatitis B infection before you can get that.
Right.
Yes.
Okay.
And it's transmitted similarly, just like hepatitis B and C.
Okay.
So sharing needles, unprotected sexual intercourse, blood and blood products, and all that. Yes.
Okay. Would the symptoms of B, we haven't gotten to C yet, right? Would the symptoms of B be the same as A and E?
No.
All right.
So when during the acute phase, so hepatitis B can either be acute or chronic.
Right.
So acute, if it's resolved, so the body is able to take care of it 6 months or less.
Okay.
And chronic if it extends beyond a 6 months period. So within the acute phase, you may have some symptoms overlapping with A and E. So you may have the same fatigue, nausea, flu-like symptoms, feeling generally unwell.
Okay.
And sometimes rarely you may get the yellowing of your eyes as well. Yes. But for most people, it's asymptomatic. So they don't have any symptoms at all during the acute
ringtone.
phase. You don't feel anything.
No symptoms, but you have hepatitis.
You have the acute infection.
Right.
And ultimately may develop the chronic infection. So that's the danger here. Because you're just walking around, probably had a headache here and there for a day or two, and that was it.
All right.
And then later you are told you have chronic hepatitis B and you've already developed complications.
Okay. Folks, let's be clear. We're talking about something that affects both adults, children, even unborn babies, right? And infants. Okay. So these are important things. In fact, in other jurisdictions where it's not resource constraint and cash constrained, you find that there's immediate mandatory testing of newborns. We'll get to that if we're doing that in Ghana, but I know it's quite expensive, but they immediately do that, and then where it's identified, the vaccinations and the protections are given. Right? We do have that in our expanded immunization of some point.
Unfortunately, we don't have the birth dose yet.
We don't have birth dose.
Yes, but we do have a dose at 6, 10, and 14
for hepatitis.
As part of the Penta vaccine.
Right.
Yes, the one that is jabbed on the thigh.
Okay.
Yes.
Right.
So we do have that. I'll come to talk about that later and why we need to embrace that.
Don't worry, we can have you 3 weeks in a row.
Yes, so
because this is serious. The reason I'm interrupting and saying this is that years ago, folks, and I've done this program since 2002, right? I finished a program on hepatitis, and a staff of our station asked me a question and asked if I could facilitate a referral. And he mentioned that he had actually lost, I think, a sibling to hepatitis. And in follow-up to the referral, the practitioner told me that it's good he came. It is good he came. And he himself came back later to thank me, right? So this is not joking, laughing matter, though I do crack some very awful jokes once in a while. Okay, so this is serious matter. So B, the symptoms vary a bit, and it's likely that you may be asymptomatic.
You may not have any symptoms at all.
Okay.
Yes. And for most people, about 95% of people would recover from the acute infection
Acute B.
spontaneously. Yes.
Your
So
body
your body
can.
is able to take care of it.
Okay.
So the ones we see
99.7
around are just
FM.
the minute 5%. So it means
Right.
that the transmission rate is really high, because even for those who come and get tested and have the chronic infection, the numbers are high.
Okay.
Yes. So a lot more people get it, but about 95% of them would have their body taking care of the infection.
Okay. And you might
And
not even
then-
be aware,
Yes, and you are not aware.
which makes you highly potentially liable to transmit it.
Yes, to somebody
unknowingly.
else. Yes, until your body is able to take care of it.
Right.
And then the 5% will progress to the chronic state, where they are carrying the virus. And the chronic state is the dangerous part, because that can lead to complications later. Like the inflammation going on over several months and years can lead to a replacement of the normal liver cells by scar tissue.
Right.
So there's scarring.
Okay.
So the scar tissue doesn't function like the normal liver cells.
Okay.
Yes. So the liver now loses its
It's
normal
compromised,
functions.
and all its jurisdictional
Yes.
functions are
Yes.
compromised.
Yes.
So your liver is not doing the job it's supposed to do to protect your body.
It's not. And another thing is that the hepatitis B virus is a very smart virus. I say that, and it's very tricky, because once it enters your system, it's
99.7
able
FM.
to integrate its DNA, its genetic material, into your genetic
It's
material.
changing manufacturer
Yes.
settings
Yes, so it enters your genetic
to become part and parcel of your
part
system.
and parcel of your system.
Wow.
So it explains why it's difficult to eradicate it or to cure it completely once you have it. So it's a disease we manage, and we have some targets for the management, but it's not something we can eliminate completely from your system once you have the chronic infection.
Okay,
Yes.
right. Are we safe to move on to C?
Yes. So another thing, as
About
I
B.
mentioned, yes,
Right,
the
mhm.
last thing to say about B is that once it integrates or joins your genetic makeup,
Right.
it can change some things in your genetic makeup and lead to liver cancer,
Right.
which is the dreaded outcome of hepatitis
liver
B.
cancer
Yes.
progressing from
From
hepatitis B.
yes.
Right.
So it can either go through the scarring pathway, where your liver is scarred, we call it liver cirrhosis,
Cirrhosis of the
Yes.
liver. Right.
and then to liver cancer, or it can go straight from normal liver to liver cancer.
Okay.
So we are seeing lots of people in their prime, so 30, 35, 40-year-olds coming with liver cancer.
Wow.
And this age is far
Joy,
less than the global
99.7
statistics of
FM.
liver cancer, which is about 50 years.
Right.
And the reason to explain this is because most people get it through the mother to child transmission that I mentioned.
So you had it from birth.
Yes.
You were unaware.
So if your mother was an asymptomatic carrier and never got tested, and then gives birth to you, and you get the infection, and at that young age, as a baby or an infant, you are not able to, your immune
Your
cells
immune
are not
system is not
matured. Yes, it
matured and
cannot
developed.
clear the infection. So most of those people will progress to the chronic state. About 90% of children who are acquired from their mothers go into the chronic state.
Doc, let
Yes.
me maybe ask you to emphasize on this. I asked earlier because in other parts of the world, the birth dose, the screening of newborns and all that, is routine and indeed mandatory. You're supposed to get that.
Yeah.
So from the get-go, you mentioned that we are constrained and challenged when it comes to that,
Yeah.
right?
Yeah.
We have a higher prevalence, especially in the rural areas. I don't even want to talk about the distribution of health centers that have the
Exactly.
capacity. So what does this really mean when we are not checking if there's been vertical transmission or mother-to-child
not.
transmission of
Yes.
hepatitis?
So that poses a very serious challenge for us. In most hospital setups, the
Joy,
pregnant women are
99.7
required
FM.
to do a hepatitis B and C screen
Okay.
at some point in the pregnancy. But as you rightly said, it's not all pregnant women who have access to quality health care.
Okay.
And even for those who do, some centers cannot test for these infections.
Okay.
And even when they are tested for and they are found to be positive, they are required to purchase the vaccine and sometimes the immunoglobulin for the child in preparation for the birth of the child. And these can be quite expensive.
Sometimes it even leads to default.
Yes,
they
so
stop
they
coming
stop coming
hospital.
all together, and then they pass it on to the child, and then we find the child grows up with it, and you find them in their 30s, when they've just gotten a job, started life, gotten married, started a family, and then they come in and we find that they have liver cancer. It's such a sad thing. Gosh.
Folks, 46 minutes past the hour of 2 on Joy 99.7 FM. I'm going to activate the phone line 030-221-6541. 030-221-6541. Ultimate Health on Joy 99.7 FM. We're doing a serious breakdown, dissection of hepatitis, inflammation of the liver, a very important organ, should be on the right side of the abdomen. If yours is somewhere else, please come and see me and Ziggy. Right, that's where it is. It's about the size of a football, average football, but it has critical functions. If it is damaged, injured in any way, hey, we're in trouble, right? And my guest, Dr. Fatima Mohammed, is sharing with us the different ways and pathways through which you can acquire hepatitis. Okay, sometimes it's acute, under 6 months, and then it goes away by itself, but it may leave some footprints, right, or take a residence permit, and therefore it becomes chronic. In some types of hepatitis, this could mean or portend liver cancer and other more serious complications. So 030-221-6541, Ultimate Health on Joy. We're looking at hepatitis, the types, the causes, the symptoms, complications, treatment, and prevention. Okay, we hope to do all that on today's menu, but we don't rush good things, right? If we have to bring her back, we'll bring her back. Okay, so 030-221-6541. WhatsApp is 055-11-11-997. Doc, so this is very serious. If we had the money, we'll be checking everybody who's born in Ghana.
Exactly.
All right.
So for other African countries have embraced the birth dose, where all newborn infants are given vaccination, against hepatitis B within 24 hours, ideally within 12 hours, but allowed within 24 hours after birth. So we already have some vaccinations that are given, right from birth. To
protect you.
Yes, so, we could advocate, to just add the hepatitis B to those ones, like the polio vaccine and the BCG, the one against tuberculosis.
Routine vaccinations. For which reason many people are alive and well today.
Exactly.
But Doc, us, you know our life, whether it's religious or just stubborn academy. There are people who are anti-vax, right? What would you say to people who may be carrying this thing unknown, right? But they are the ones who share all the spurious stuff about vaccines and the harm they do. What would you say to that?
Yes, so vaccines are generally safe. I wouldn't say that they don't have any side effects. However, the side effects are not that serious as compared to the diseases that they are invented to prevent. Yes, so if you look at the side effects versus the benefits, it's always good to go for the vaccine. Yes, in special circumstances, you may have to speak to your doctor, and then something
if
can
you
be
have
worked
concerns.
out. Exactly. And you still get the protection that you need. So the Global Alliance for Vaccines and Immunization, Gavi, yes, has pledged support to any country that is willing to embrace the birth dose. Our neighboring country, Nigeria, have embraced it, and they are seeing a downward trend in the vertical transmission.
So they are able to meet that criteria within 24 hours? Give the baby the protection?
They've rolled it out. So we're expecting Ghana to do same last year, but we are hoping that, it's not too late within the year. Using your platform to advocate to all stakeholders involved. We're in. It's a very important thing to do, and it would really help to mitigate the transmission of hepatitis.
Doc, we've done D. Can we talk about C, which is another troublesome one?
Yes. So hepatitis C, just like hepatitis B, is also transmitted in a similar way, but more of exposure to blood and blood products. So people who have had repeated transfusions, especially before the 90s, because that's when the screening of blood products. Yes. So you see that those who had transfusions in the late 80s and early 90s may be carrying the hepatitis C
Not
virus.
applicable to transfusions done under the current model.
Yes.
Right.
Yes.
Where we screen the blood.
We screen them.
Okay.
Yes, so the risk is very low.
Right.
Very, very low. However, we also have some people who have who inject drugs, so drug abusers. Yes.
IV drug users.
Yes, and because it's illegal, they share needles and share sharp objects.
Right.
And these people are at a higher risk.
Okay.
Even in our local setups. So people who go for these herbalists to make marks on their skins.
Tribal scarification.
Scarifications.
Right.
They use unsterilized knives and they reuse them
Even
often.
applies to our wanzams.
Exactly.
Yeah.
Circumcision and all that.
If not done under the proper.
Exactly. They are trying to train some of them, but we still have the others who are not under the training setup, and so they still do these unsafe things to children and other people.
Okay.
So all these things can increase your
and
risk.
Doc, can you say a word about those who are doing tattoos and all the body art and body piercing?
Yes. Tattooing is one of the major risk factors for hepatitis C infection, as well as unsafe dental procedures. So I would like to mention, so our Muslim brothers and sisters, whenever they embark on the Hajj pilgrimage, and then they go get their gold tooth fixed, you know, some of these dental setups, they are highly commercialized because there are thousands of people coming in on a daily.
What's the thing with the gold tooth?
I mean, I think it's just a cosmetic thing.
It's cosmetic.
Yes.
All right.
And, you know, they go through it without sterilization most of the time. Yes. So they do thousands of people using the same equipment, and you are exposing yourself to bloodborne infections like HIV, hepatitis B and C.
I told you if it affects your health or well-being, we'll talk about it. We're talking hepatitis, but we're going deep with Dr. Fatima Mohammed on Ultimate Health, Joy 99.7 FM. We're almost out of time, but I'm going to spend the remaining time to look at diagnosis. How do you know conclusively, not just because you feel you have some of the symptoms, right? How is it tested for, and what do the tests tell us, Doc?
Yes, so we do a blood test for both hepatitis B and C.
Okay.
We draw your blood and we check if you've been exposed. That's the first layer of diagnosis.
Right.
So for hepatitis B, what we do as the screening tool is to check for the surface antigen.
Okay.
It's a part of the virus. So when the virus enters your body, it leaves some footprints. Okay. And then we use those ones to determine whether you've been exposed or not. So hepatitis B surface antigen is what we screen for. And if you are found to have it, it could mean that you have the infection, or you have been vaccinated. Okay. Yes. Right. So then we now go to do a full profile, hepatitis B profile, to look at the other footprints. Okay. And that would tell us whether you have the chronic infection or not. Okay. Yes. And so once you are screened and you are positive, you don't need to panic. You have to go through, go to your doctor, get the next step of the test, which is the hepatitis B profile. Yes. Which will give you the real state of the nation. The real state, yes. The first one will identify whether you are in or out. In or out. Right? If in, you still need to go further to get tested. Testing. Yes. And that testing will show... That testing will show whether you have a chronic infection. Okay. Whether the infection is actively replicating. Sometimes the virus is just sitting there. So we're talking about viral load. Yes. Sitting there and not multiplying. Okay. And the profile will tell us whether it is actively multiplying or is just sitting there. Okay. For now. Right. And after the profile, if you are determined to have a chronic infection, then we now ask you to go and do the viral load, which is the DNA. Right. It quantifies how much viral genetic material is in your blood, and this has a direct correlation with the outcome. Okay. Whether you are going to develop complications or not. Right. The higher the viral load, the worse the outcome.
So, Dr. Fatima, all these different tiers or levels of investigation are critical once you are identified as positive.
Yes.
It's not enough to know you are positive.
Exactly.
Right? You must know whether it's been there for a long time, whether it is active,
Yes.
whether it's aggressively multiplying itself,
Exactly.
right?
Yes.
And these are important markers that the doctors need to actually manage you.
Exactly.
Right.
So over the years, there have been lots of education on hepatitis B, its diagnosis, even to healthcare workers.
Okay.
Because you find people saying that, oh, they checked and I had, they said my infection is not that serious, so
Right.
I'm fine.
You're fine.
And they stop coming to the hospital. One thing about hepatitis B is that, as I mentioned,
Very smart.
it puts its DNA into your DNA. It can be quiet for a while, but we can never tell when it will start multiplying again.
Okay.
So once you are found to have the chronic infection, you have to always come to the hospital for what we call surveillance, for us to keep an eye on you.
Right.
Because at any point, if it reactivates and it multiplies, it can quickly damage your liver.
Okay, Doc, whilst I'm under surveillance, you're monitoring me, are there things I should be observing? Let me quickly take this call and come back to you.
That's
Right. Hello, good afternoon.
Hello, good afternoon.
Yes, sir. Who am I talking to?
Yeah, I'm talking to Abu Muhammad from Japan.
Abu Mohammed from Japan.
Yes, sir.
Is she your sister?
Oh, not necessarily.
Okay, please go ahead, Abu.
Yes, concerning the circumcision, some of us, this is our understanding. We believe that if these our local people do it, it's far better than the medical people does it.
Right.
We think they understand better, and most of these people have been doing this for so many years. So things like dislocation, broken arm, and all that, those of us who have this understanding, I want Madam to convince me, because some of us, this is how we understand. We believe that when it comes to such things, you better go to the native people than medical people.
Okay.
Sometimes when you have a broken leg and POP is put up, it's rather worsen the case. But when you go to Mixeba, so the ones that saying, this is how we understand.
Right.
So how will Madam further convince me?
Okay. Abu Muhammad wants to be convinced by Dr. Fatima. Dr. Fatima, there's another caller? Okay, let me quickly take the other caller and come back. Hello, good afternoon.
Good afternoon.
Hi, who am I speaking to?
Amy from La Paz.
Amy from La Paz. Please share with us.
Yes. Please, I would like to know if a man at age 50
Hello, Amy.
and is negative, can he go ahead to do or have the 3 doses of the vaccine?
Okay, if I get you right, if a man above 50 tests and he's negative, can he go and do the vaccination?
Yeah.
Okay.
Thank you.
Right. You're only interested in men?
Oh, okay. Anyone.
Okay. Or you have a man
Thank
in mind there. Right. Just quickly, Doc.
Yes. So
You
the
test
second
negative.
question,
Yeah.
yes. So once you test negative, I forgot to mention that sometimes the surface antigen can be negative in a very small percentage of people. But when you do the profile, you find that the virus is hiding somewhere.
Okay.
It didn't leave a footprint.
In a small percentage.
In a small percentage.
Right.
So in that group, we recommend that you do the profile
Okay.
before you vaccinate.
Okay.
Because you may have what we call an occult hepatitis B infection. It's just hiding somewhere.
hiding,
and you
latent.
may think that you've vaccinated, but you
Right.
still eventually get the complication.
Okay.
Exactly.
Right. So the virus has a screensaver that makes it look good.
Yeah.
But then desktop is not good.
Exactly.
So you need a deeper, higher, more
Yes,
advanced test.
exactly.
More sensitive test.
More sensitive.
All right, I'll
test.
come quickly. We're already at 3, but just quickly, the traditionalists like Abu Mohammed in Japan, he says, look, we believe our people, they've been doing this for yonks, and we see the benefits, whether they are setting bones or doing circumcision. Indeed, a wanzam is a traditional barber. They do all sorts of things,
Yeah.
okay? But he wants you to convince him about infection control, which is what we're talking about,
Yeah.
right? He's not convinced.
Okay, so as a rule of thumb, we stay away from discouraging people from what they are used to.
Right.
What we'd rather do is to work with those people to ensure that they have safe practices. So traditional birth attendants, wanzams or the circumcisers, we invite them for training sessions. So make sure that the wanzam you are going to is someone who has been certified and has been trained.
Yeah.
Another thing we can advise is for you to get your own knife, which is new. It's the technique that you want.
The technique?
Yes.
Sterilized
new equipment.
New may not be sterilized.
Yes.
Right? But yeah, Doc is saying make sure, right, that you're going to the right place and you are safe. Okay, you may get your bone set, you may get the thing you wanted, you may have your foreskin snipped, right, or circumcised, but you may leave there with this infection or this disease we are talking about. That's what you're saying, Doc.
Yeah.
All right, great stuff. Doc, we'll have to come back and do treatment. Okay, you're not going back to Tamale too soon.
No.
All right, I'm sure it's not only Abu Mohammed in Japan who is convinced. There's another caller. Hey, Ziggy. All right. Hello, good afternoon. Hello. Hello, good afternoon.
It's Amy again.
Amy, yes, my dear.
Yes, please. Those children who were vaccinated in childhood with the hepatitis C and hemophilus influenza.
Yes, Amy, just quickly, just lower the volume on your set and then continue, okay? Yeah, go ahead, shoot.
So I'd like to know if they can go ahead to vaccinate for a booster dose after 10 years, because they were given 3 doses during the infancy.
Right. Okay, great stuff, Amy. I love your question. So, you've had your childhood immunization or vaccination for hepatitis?
Yes. So Ghana embraced the hepatitis B as part of the expanded program on immunization, I think after 2002.
Okay.
So all those who received their full complement of the Penta vaccine, the 5-in-1, would have been fully vaccinated. However, if you want to know if you've developed adequate immunity, then there's something called the antibody titer. That you can check.
Right.
And if it's below 10, you are not immune. You may have to take the vaccine again.
Take it again. Okay.
But if it's above 10, then you are safe.
Okay. Right. These are informed steps. Okay. You're not guessing and doing anything random yourself. Right. There's a specific test that can help to classify and identify these people and then guide the management decisions. Great stuff. It's been great having you, Doc. And I'm hoping next week we can break down the tests, the treatment, because that's where there's a high default.
Exactly.
Even some of the tests we're talking about, many people are deterred by the costs, right? The costs involved in even just diagnosing, isolating it. So we need to look at where the gap is, where we are losing people. 3 minutes past the hour of 2. 3 on Joy 99.7. This has been so revealing. I hope you've been informed and transformed, because that is our objective. Ziggy and I wake up and we decide what can we change, what can we do, and that's why we do this and every Sunday 2:05 we come alive with all the issues. Once again, many thanks, Dr. Fatima Mohammed. Abu in Japan. Next week we want to make sure you are convinced. But if you don't know, many years back, in fact not too long ago, we have a wanzam in Malata Kotobadi area. Baba Wanzam. I'll see if I can bring him again, because I do know, and my mother, almost 88, is a midwife. Midwives, wanzams, traditional birth attendants, they've all received training and capacity building, because they are the people on the ground in most of the communities, right? So there's a lot of work that has been done there, but the concerns about circumcision, body art, body piercing, tattooing, and all these things are important. Once again, Doc, we are most grateful.
Thank you.
And of course, most grateful to my producer extraordinaire, Ziggy, who has instructed me that if I don't continue with my lumbalicious observation, he'll do something. All right? So I'm going out. This one is Adakatia, right? Lumba, forever in our hearts. Stick and stay. My name is Nortey by nature. I'm out.